My name is Maulik Thacker. I work with LifeBridge Health. I am the executive director of our Zero Harm program. And under this program, I oversee quality improvement efforts for acute care hospitals. I also oversee the project management arm that really helps us improve the current infrastructure when it comes to technology, processes, right? And also implement new things like Riskonnect. And on top of that, I also oversee clinical quality analytics team. So think of healthcare, all things clinical quality analytics, kitchen sink. That's what we do, and we serve great analytics in terms of reports in Tableau, reports in Riskonnect. Reports really help us get to the zero harm, which is our ultimate goal, making sure we have a space which is the safest for our patients to receive care, and we do not cause any harm while they are coming to the place of healing. LifeBridge stumbled upon a journey of really progressing forward, moving forward, just like many other health systems who were evolving. And we were also evolving, and we were growing, and we realized our legacy systems, which were back in the days supporting our patient safety and quality needs, are not future ready. And we wanted something that is future ready, that really helps us not only learn more about our own organization, but also helps us be ready for the future, for AI, right? For advanced analytics, for enterprise-wide risk management, opens up the horizon, the big picture thinking, the broad spectrum thinking. And that's how we really landed on the journey of Riskonnect. And we had very thorough vetting process with multiple competitors of you guys in the market, and your team stood out from get-go because this was one-stop shop built on Force platform, which makes it very easy to use, implement, and scale up. And that was very important for us, scaling up and interoperability. Those two things are very important for us as well. It's been a great success, resounding success. Ever since we implemented Riskonnect at LifeBridge Health, we have received wealth of knowledge from our frontline staff members. Our goal was to give the voice, speaking up for the safe care. And Safe Care is the brand name for our own internal portal that we have developed, which is based on Riskonnect. And the whole goal was to making it easy for our frontline staff members to speak up. And speak up bravely, care bravely, and report whenever they see something went wrong or could have gone wrong, but we prevented it. We call it good catch. Make it easy to capture those stories, and we learn from that. It's been a resounding success. In just past 2.5 years, we have over 12,000 events reported in the system, and we make sure that we close the loop on every single one of them by engaging the frontline staff members who reported that, the mid-level managers, and senior executive team. If we have to make any process level changes, if we have to make investment, we support those things, and we make sure that the future, right, going forward, learning from these incidents and errors, we are making it safer for the future of our patients. So it's been a great resounding success. Back in the days, we had to wait a long time to learn about what's happening in our own backyard, right? Now, we know exactly what's happening in real time. Every morning at 6 o'clock, our executive team and all the leaders in the organization wake up with this automated email delivered directly into their inbox, which captures a story of past 24 hours. What happened in the past 24 hours at hospital A, B, C, and D, and what happened in past 24 hours across the health system in just one single email. So the situational awareness of it is just great. We had to really wait for a long time back in the days, for a month, for somebody to really sit, download the report in Excel, analyze the reports, and then deliver the analysis, versus now we wake up every morning with a clear analysis and an awesome situational awareness of what's happening in our own backyard. We underestimated the benefit of it, I would say. We always had a goal that we do want to improve the number of events reported in the system by 3 to 5%, but we actually have seen 10 to 12%, in some cases 15-20% jump in number of events reported using the system. And that has really unlocked the potential of learning more about our own health system, like what our frontline staff members are witnessing every single day. And it has really empowered our executive team to make decisions, timely decisions, informed decisions, because now we have stories and experiences of our own staff members to support. Riskonnect has many visibility tools and capabilities, but from get-go, what we love the most is its real-time reporting. Our executive team, our frontline staff members, our managers, they love it because once you put anything in the system, it is so easy to get out. It gives you real-time alerts, it gives you notifications. So now you don't have to wait for many hours to really know what's going on. You can respond to it immediately. The situational awareness is just phenomenal. For talking about results, there is one thing to have lots of input coming your way in terms of feedback from frontline staff members, be it near misses, be it good catches, be it actual harms, right? But also what's important is closing the loop in a timely fashion. Riskonnect has allowed us to track and trend every single movement with a patient safety event throughout its life cycle so that we can make sure that we close a loop, like learning from the mistake or error, fixing the problem and making sure it doesn't happen again, say in 30 days. And we have different goals. Some things have to be closed in 12 days, some things have to be closed in 30 days, and some things should be closed in 90 days, depending on the acuity of it. But now we can track, trend, and enable our managers to really solve those problems for good and track also, are those changes really making meaningful impact or not? Just like many other health systems, we also struggle a bit when it came to pandemic with pressure injuries and patient falls and continuous strain on staffing. After learning from our Riskonnect system through RCAs, we learned there are a number of factors that we can, there are a number of strategies and tactics we can implement to really prevent those patient falls and prevent those pressure injuries. And we have seen tremendous improvement in both pressure injuries, which were very acute, have gone down, and patient falls with major acuity also have gone down because we were able to learn from those mistakes and errors and learn from those RCAs, root cause analysis. We are very excited when we were about to launch Riskonnect system, and we engaged our own marketing team, and we shared like our visions. These are our goals. We want to see an uptick in reporting. We want to see engagement, more engagement from our frontline staff members. We want to see more engagement from our executive team. So these were 3 goals. So we started with branding ourselves. What should we call this tool? And we came up with the word safe care because that's the ultimate goal. We are trying to provide a safe care. And from that, we build lots of marketing material, flyers, screensavers, mouse pads, you name it. We had QR code, which was making it very easy for folks to pull up their phone and report a safety incident using their phone. Something that we were not able to do in the past. But what really drove us home in terms of engagement is the good catches. Staff often associate patient safety and risk reporting with something that went wrong, and it's after the fact. What we are working on, and I would arguably say we have successfully made some inroads in the culture, is we are trying to be one step ahead. We are tracking those near misses, good catches, which is preventing the mistake or error from reaching to the patient. And that is something that we are celebrating really big time using Riskonnect because most of these incidents are associated with preventative harms. And we are celebrating them by giving them awards and all of those things. 3 things come to my mind when it comes to really strong partnership with Riskonnect. One is the responsiveness. Whenever you want somebody to listen to you, there's always a helping ear. Second thing comes to my mind is understanding. Whenever you want somebody to understand your world, your problems, your priorities, they are always there and willing to sit down, listen, and not only listen, but also act on those things. And third thing that comes to my mind is the creativity. Riskonnect is always willing to accept more feedback, work on creative ideas, and open for customization. And that is the key for us working in healthcare because the industry is changing so exponentially every single day. We really have to keep up with those changes only by being adaptable and agile. And Riskonnect has really helped us be nimble and agile. When we talk about risk under one roof, we are looking for an end-to-end solution, one place that houses all the wealth of information that really empowers us executives to make smart, timely and efficient decisions. I think the Riskonnect team is phenomenal. I mean, these guys are clearly passionate about the work that they are doing. The team is really knowledgeable, and when it comes to risk, I think they are really strong subject matter experts in the industry. And one more thing I never mentioned, the reason why it was very important for us to select Riskonnect over any other competitors in the market is because Riskonnect not only caters to healthcare, but to the spectrum of the industries across the world. So that was very important from us because we oftentimes don't learn from other industries, like from example banking, or we don't learn from Disney, or we don't learn from entertainment industry. But with this platform in our foresight, we can learn from different industries and include those learnings into our practice. We don't have to repeat the same mistakes they have made.